Where is a cystoscopy procedure usually performed? Have you ever wondered where a cystoscopy procedure takes place? A cystoscopy is a medical procedure that allows doctors to look inside the bladder and urethra using a thin tube called a cystoscope. This procedure is essential for diagnosing and monitoring bladder health, especially when it comes to detecting issues like tumors or inflammation. Most cystoscopy procedures are performed in outpatient clinics or urology offices. These specialized clinics are equipped to handle the procedure safely and comfortably. Often, flexible cystoscopy can be done under local anesthesia, making it a common choice for routine diagnostic checks or follow-ups for bladder cancer. For more complex cases, such as when a rigid cystoscope is needed or if a bladder biopsy is planned, the procedure may take place in a hospital. In these settings, cystoscopy is usually performed in an outpatient surgical suite or an operating room. Hospitals have the necessary resources for sedation or general anesthesia, which is important for managing any complications that may arise during the procedure. Additionally, many urologists perform cystoscopy as an in-office procedure. This setup allows for quick assessments without needing a hospital admission. It is particularly common for initial evaluations of bladder symptoms, such as blood in urine or for stent removal. The location of the cystoscopy matters for several reasons. Performing this procedure in a controlled medical environment ensures sterile conditions, which helps reduce the risk of infection. Access to appropriate anesthesia and emergency care is crucial, especially when biopsies or other interventions are performed during the cystoscopy. Regular cystoscopic surveillance is a standard part of managing bladder cancer, often conducted in outpatient settings to monitor for recurrence or progression. In summary, cystoscopy is usually performed in outpatient urology clinics or hospital outpatient departments. The choice of location depends on the complexity of the procedure and the needs of the patient. These settings provide the necessary equipment, sterile environment, and medical support to ensure that the procedure is safe and effective for evaluating bladder health and diagnosing or monitoring bladder cancer. Always consult with a healthcare professional for personalized medical advice regarding cystoscopy and bladder health.